Keeping Nairobi's promise despite COVID-19 pandemic, challenges and achievements in Congo. The COVID-19 pandemic was a turning point, with first case confirmed on 14 March. Promptly, government and partners organized the national response. In line with National Response Plan, UNFPA approach focuses on strengthening health system capacity, procuring and delivering essential supplies and personal protective equipment, ensuring access to sexual and reproductive health and gender-based violence services, and supporting communication and community engagement. UNFPA mobilized its expertise in support of the national coordination mechanism with 8 UNFPA experts mobilized and 20 national staff in data processing and analysis.
Cette formation a été très bénéfique pour nous, en effet, parce que en fait, nous avons appris de nouvelles méthodes, de nouveaux outils pour collecter les données en lien avec la riposte de la COVID-19 au Congo.
UNFPA contributed to ensuring the continuum of care and access to sexual and reproductive with midwives in the front line.
Au Congo, toutes les sages-femmes, au nom de l'ONASAFCO, que je parle au nom de l'ordre des sages-femmes, notre slogan est que nous voulons qu'aucune femme doive mourir dans l'accouchement et aucun enfant ne doit mourir en venant à la vie.
Deployment of 13 midwives and 9 psychologists in the most affected areas, including humanitarian. Provision of personal protective equipment to medical personnel, ensuring the supply of essential medicines, equipment and reproductive health products. Implementation of the protocol for pregnant women affected by COVID-19. Implementing Liloba initiative, which means voice, to address holistically GBV in the context on COVID-19. The main outcomes are UNFPA engaged young people in partnership with Ministry of Youth mobilized youth associations. 5,500 youth sensitized in Brazzaville, Pointe-Noire, and Dolisie, the most affected cities.
Je dis merci beaucoup au FUNEAP d'avoir eu cette idée de former les leaders des associations afin qu'ils puissent former d'autres personnes. Parce que la meilleure communication en formant des jeunes, la meilleure communication se fait de jeunes en jeunes. Si vous sensibilisez déjà une grande partie des jeunes, cette partie-là aussi pourra sensibiliser le reste des jeunes du pays.
Over 30,000 young people mobilized through social media. Digital solution is due COVID developed by youth with over 1,000 downloads at the launch. Census mapping conducted during COVID-19 confinement. The conduct of 2020 census was one of the key Nairobi's commitment, as the last census was conducted back to 2007. Documented as a good practice, this exercise has followed an evidence-based process. Technical note to inform the decision-making process. Decree from Prime Minister to enact the government decision. Communication from the Minister of Planning in charge of statistics of public media. Awareness raising campaigns. Provision of protective equipment to field teams. Regular assessment of the feasibility of the strategy. Close monitoring. Then census mapping achievements are: census mapping concluded on time. High coverage and response rate 99%. No confirmed case of COVID-19 has been observed among the 300 field staff. Geo-referenced database available on population and infrastructures to support decision making. In the spirit of leave no one behind principle, special attention was given to indigenous community, people with disabilities, women living with HIV, women and girls victims of GBV, IDPs and refugees. More than 100 persons with disabilities sensitized with adapted tools and provided with personal protection equipment. Indigenous population representing 1.2% of the total population living in remote areas has been sensitized in local languages with drones.
Beshakan kwa kinira mamun. Padisha buba bishilora bishila mamun chaka bubu. Du kwa dingir chibu. Bulla bioji tum kwa dingir. Gwa inte. Besha malan ko manan kwa dingir kwa kinya. Adaka besha kwa utake likumo beshaka utake into abeshige yaka ngo beshin kwa clear ma ya bie.
More than 4,000 refugees and IDPs sensitized and provided with sexual and reproductive health and GBV services. UNFPA Congo builds on its trusty relationship with government, civil society, youth associations, media, beneficiaries, UN agencies, and all other partners, including World Bank and private sector. UNFPA on the track to achieve the 3 zeros. We keep the Nairobi promise despite COVID-19.